Hi everyone, my name is Paloma Raggo. I am a faculty at Carleton University, and with my colleagues, Kristen Pugh, Susan Phillips, and Callie Madison, we have been working in partnership with Philanthropic Foundation Canada and Community Foundations of Canada on this research project over the last year. In this project, we are trying to understand how foundations reacted over the entire year. So I'll get today into the specifics of the ways in which, I apologize, I'm trying to say, the ways in which we did this. And if you have more questions about the methodology, and I think that's a really interesting part of this project, feel free to ask after. Today I will present the sample just to give you an idea of the scope of the study. I'll discuss the methodology, which is a Delphi process that we have adopted and then further developed throughout the last year, and show you some of the early findings. We don't have all the data analyzed yet because we literally did the last round a few weeks ago. So this is very much work in progress. And in terms of participant samples, so overall we talked about, we created these panels. So 21 foundations were in our set of panelists that we called. And these panelists answered questions every 6 weeks or so about various topics, which I'll talk about. So we had different organizations, community foundation, DAFs, public foundations, and private foundations. The idea of creating this panel was to track over time their responses. In terms of methodology, more specifically, we used what is called a Delphi process. This process is quite interesting because it's a combination, if you want, of using surveys in a way that's very iterative. So the idea here is simple, is that we sent questionnaires to people who have expertise in their field, and in our case, in their foundations that have a good sense of what's happening. They give an answer which we analyze. So every round, every session that we did over the year will have this specific format. So we have the questionnaire developed based on theories and threats that we have observed. We send the questionnaires to our panelists, our 21 panelists. They answer. We as a research team analyze the answers, code the data within a day or two, and then we create a new questionnaire which we send back within the same week. People answer, and once the week is done, we call this a session, and once the session is done, we report back to our panelists and tell them about the trends that we're observing in the data. So this process we did 6 times over the last year. So we started in May 2020, and we May 2020, and we ended in 2021. I have a typo there. So each round had 2 surveys. Each session had 2 surveys sent. In terms of themes, what did we ask these panelists over the entire year? So we asked several questions about their perceptions of change and how their work had changed, the ways in which they adapted to the change, and we focused on not only broadly change defined, but also at the micro level within their organizations and their processes. We asked them questions about collaboration. We were curious to understand whether or not during the pandemic there were more collaboration, less collaboration, and the types of collaboration. We asked them questions about information and data. From who are they getting their information, their facts, their data? in a time of crisis. For us, it was really interesting to understand whether or not it was really information flowing from their peers or whether or not they were looking at outside sources of information. We asked them naturally about their challenges and things in which made their work more difficult. One theme that emerged at some point that we didn't necessarily include initially was this theme of diversity, equity, and inclusion. As we all know, the events of last July had really been a catalyst within the sector to talk about issues surrounding racial justice and more. And then we concluded the sessions with questions about their perspective in the future, how confident they feel about the foundation sector. So today we have so much data to analyze that I cannot present you all of it, but if you have questions after, I'm more than happy to give you some hints of what we're finding. So to give you an example here in this chart, what it represents is each different bars represent a different session. So as I said before, each session was composed of 2 surveys that panelists did back to back. And so when asked, how much has the work of your foundation changed as the result of the pandemic, we found that surprisingly, the answers were consistent across time. So meaning each time we asked them, they repeated the same answers. And that's actually quite surprising when we do surveys in general, to observe such consistency. One interpretation could be that in this case, the pandemic affected many aspects of the foundation's work, but it wasn't necessarily as a game changer as the narrative that we're creating right now around changes brought on by the pandemic. We like to talk about how transformational, how it changed everything. It did change things, but perhaps not as profoundly as we would have expected. So on average, here, people rated their change from 0, not at all, to 10, a great deal of change, to an average of 6, with the median slightly more conservative, actually, around the 5, meaning that at the end of the day, people perceived really middle of the road type of change. When asked the question about adaptation, and so again, this is a question we asked round after round, sessions after sessions after sessions. We asked them overall, how adaptive would you say your foundation has been in responding to the COVID-19 pandemic? And what's interesting here in terms of adaptation is, again, the consistency is really surprising, but the average here, the adaptation is much higher. In an adaptation, a mean around 8. So if you see here the 8, and with a median also of 8. So one could think, yeah, sure, everyone likes to think themselves as adaptive, therefore it's not that surprising. But what's interesting is when we start asking them about from a session to another, that's where we noticed and we found much less higher differences of change. So people from one session to the other noted little change, little adaptation. This points us to this idea of the effects of the pandemic have been incremental, and the foundation per se have been very skillful at adjusting slowly over time. The interesting thing about a study like ours is that if we had done a survey, let's say, imagine in May 2020, and another survey in 2021, we would have seen very few, either, yes, there has been a lot of change, and we would have mischaracterized this change as game changer. But with the data that we're seeing over time, we really are talking about an incremental change in adaptation strategy overall. In terms of adaptation, we were also curious about how they adapted and where did they innovate. And so when we asked the organization, how has your organization innovated during the pandemic? Many and a lot of the people mention innovating through their internal process. So a lot of the changes, adaptation, and innovation has been done internally. It's not to say that they haven't changed the way in which they do business. And we see this in some of the data we've gathered, that they are implementing changes in the way they're granting and in the types of causes there are. But when asked what's the biggest source of innovation, it's really internally. Another source really interesting that we thought was in terms of innovation through partnerships. So it's not so much, and I'm not presenting all the data we have on partnerships, but interestingly is foundations have noted that they are collaborating, partnering with about the same level as pre-pandemic. Some a little more, but on average, it's relatively consistent. But what has changed in their answer, and that for us is really interesting, and we're going to push this a bit further, is that they have deepened their collaboration. So over the last year, what happened was not a race to make sure that we find new partners to do things, but within the partnerships already existing is to make sure that these partnerships work, that these relationships are fully developed and implemented, and thus generating a greater engagement with the community. And so we found that process interesting. Rather than going wide, they were really going deep over this past year. Apologize here. In terms of challenges, we all know that there were several challenges related to the pandemic. One of the most often discussed, and this has been a theme that came up particularly towards session 4 or 5 and the last one, is the pandemic-related fatigue or anxiety. And this is really an important reminder for us all to take care of our own. There is a lot of mental health issues seem to be bubbling up. It would be important for foundations to, again, look inward and make sure that the people they employ are supported. This was by far the most important concern and pressing concern. So the pandemic will definitely have a very important implication in terms of how we deal with human resources, and to a certain extent, the trauma of the pandemic within our ranks. Another important challenges has been adapting strategies in a changing environment. So as I mentioned before, what we've noticed is that change was really incremental. But when things change, constantly adapting is also difficult. And it remains to be understood, why is this so challenging? Is it because people have what they call pandemic fatigue? Or is it because at some point you realize that you are further or in a different place and haven't had time really to adapt? You have changed, but haven't really solidified that change. Another important challenge was the pace of work and workload management. Again, this ties back to this idea of people were doing more. A lot of us thought entering the pandemic that we would not necessarily be productive, we would do less. But we found quite the opposite, that people workload increased, pace of work increased, and particularly in the group of foundation we discussed. All these other concerns are important, and the ways in which we created this list was to ask an open-ended question in the first round of one session, and then coding these answers and giving a list to our participant in order for them to select among the list. And these were the top 3 concerns. So pandemic fatigue, adapting in a changing environment, and the pace of work and workload management. One aspect that came up during our year, and that people started really talking, and it was quite interesting for us as a research team to bring this into our research. Because in July, when we were preparing our round, we decided to say, hey, we should ask Foundation about what's going on and the ways in which they think about diversity, equity, and racial justice. This question was asked at the end, so this is just fresh off the press. We asked, has your foundation increased its attention to social inequities or community vulnerabilities over the past year? And of those who answered the question, 88% said yes. And at the beginning, when we started asking this question in July, people were expressing that the conversation were starting, that they were trying to think about ways in which they could approach these subjects. But we're seeing very much now in the last round that we just concluded in April, that people were actually starting to concretely implement strategies, try to find new ways to engage with marginalized community members, population, within their sphere of competency and within their sphere of activity. This tells us that fundamentally, perhaps the pandemic in conjunction with the July event really allowed this transformation, deep transformation, to happen to a certain extent. And this is something we'll probe a bit more. In terms, we asked so many questions that I wish I had more time to present you all the data, but one thing that was really interesting when we asked our panelists to answer and rate their own boards in terms of their own diversity. So we asked them to rate from 1 to 10, to rate from excellent, good, weak, or poor, their diversity on these specific aspects. What we learned here is that gender parity seems to be the most achieved, seems to be the most achieved diversity dimension within those. So more than 82% said good or more. What's a bit, not shocking, I say, but something to really think about is including people with lived experience on the board is really something that the sector and this group at all maybe had not considered or are not doing per se. And so more than 83% said they rated themselves either weak or really poor on that aspect. So there is obviously some improvement that could be done in terms of racial and ethno-cultural, but lived experience is also, and as we know, these can be oftentimes overlap, is not something to forget. I won't necessarily elaborate on the mental health because I've already touched about, but I just wanted to conclude and say the next step for our research, now we are conducting individual one-on-one interviews with the panelists in our group to really probe more deeply and come back to them about their answers, their questions. And so we're trying to have a really more understanding of why they answered the way they did. Next week, we're hosting a roundtable forum where their identities to each other will be revealed, because throughout the process they were anonymous to each other. And there the opportunity will be to really talk about what all this means and reflect about the year that has gone by. If you have any questions, feel free to email us, and we're happy to talk more. Thank you, Kristen.